the stage of kidney cancer you have is determined really only after all the other information you can get is there, and usually that does involve surgery. The stage is based on a range of things. The first is simply size. So stage 1, 2, 3, and 4. Stage 1 kidney cancers, they will be referred to as small kidney cancers. But sadly, small in the kidney cancer world is about 7 centimeters. Most Americans really don't understand centimeters, but that's about 2 3/4 inches. So that's the size of a pretty decent lemon. The problem I see for newly diagnosed patients is that we're so grateful to hear we have a small tumor. We never translate what small means. So that, what the size really means is part of the staging. If your tumor has not really left the kidney, hasn't moved outside the area of the kidney, isn't metastatic, and so on, then you are in stage 1. You will not know that likely unless you have all the proper CT scans in particular. Part of the difficulty is that though you might have a stage 1 cancer under 7 centimeters, it can also already have spread. Then it would move into an upper stage, up to perhaps stage 4. And that staging will come properly only after you have a thorough look for all the cancer that perhaps is not really at the kidney. I think a lot of patients get in trouble because they assume, as do their doctors, that this is a 5 or 6 centimeter tumor, seems to be in the kidney, therefore it's a stage 1, and therefore there's no need for ongoing treatment at that time. However, a tumor that's as small as about 1 inch in diameter has, according to the latest studies, tipped into a more aggressive state. And that might be called grade in your analysis. But when you have a small tumor, again, perhaps 2, 3 centimeters, that can still be aggressive enough to have sent out what I just call little colonists for the spread of cancer into other parts of the body. So anyone who has a tumor that requires discussion of an operation should also go hunting for any other small metastases or spread of the cancer. Kidney cancer often goes to the lungs, then to the bones and the liver, but can go almost anywhere. So certainly a CAT scan, not just a chest x-ray of the lungs, is necessary, and a bone scan. And then with that, and with the likely subsequent surgery, you will have the fullest understanding of the extent of the disease, and again from there, some idea of how it needs to be treated.